by government means if the establishment was complete, if we had all the 1,200, every doctor would be looking after 34,000 people. Every doctor, one doctor, 34,000 people. The World Health Organization recommendation is that a doctor should not look after more than 1,000 people. 1,000. Ours, if the establishment was complete, would be looking after 34,000. But even if you include all the doctors in the private sector, in Uganda, every doctor in Uganda, if you take their totality, their total number, every doctor is charged with at least 12,000 Ugandans. All over, 12,000 per doctor. No such a plan. The second plan would have been to prepare Ugandans to defend themselves against the pandemic by improving their immunity. Should have been a critical plan to improve the immunity of Ugandans. Because without medicine, this pandemic has no medicine, has no prevention. And it spreads very fast. Therefore, the assumption must be that every person will get it, sooner or later. The question is how your body is prepared to meet with it when it gets to you. That's the difference. So we should prepare to defend our people, starting with the most vulnerable, the elderly, people who already have a number of other problems. And in Uganda we have many. We have 1.4 million people already affected with HIV. 1.4. So the immunity of those is already threatened. What happened in the pandemic? They locked them out of getting given the treatment they were getting. Because there was no plan to protect them. So people with heart conditions, they could no longer go to the heart institute. People with high blood pressure who were on regular treatments could no longer access their treatments. And so on and so forth. So we should have defended people through improving their immunity, starting with the most vulnerable, the pregnant mothers and others who are special categories. But also for the whole country. No such plan at all. If that plan was there, the food, the portion, the literal portion, rotten portion sometimes that was being distributed could have been fortified with vitamins. So that's the second plan that we did not have. The third plan would have been a plan to understand how the virus, first of all, where the virus came from and how it is spreading. Because it is after knowing how it is spreading that you can effectively erect barriers and control it and plan other activities around it. You must know how it is spreading. There should have been a plan of surveillance. A plan that never was. All the testing that was going on, they were testing two groups. One, the people who had come from abroad within 2 weeks before the close down of the airport, and their contacts that they could trace. Those are the ones that they have been trained. testing. The second group, the trucks. But in the case of the trucks, they were only testing them for fun, I think. Because they would test them and the trucks continue spreading if they had. And indeed, if we get a tragedy, which is still quite possible, those trucks would have had a very significant element in doing that. But, you know, surveillance in the whole population, an attempt at it did not even begin until the end of the second lockdown to test in the community. It did not begin until the end of the second lockdown. And that was, I believe, possibly, I would like to think that it is because of the bombardment of our exposure of what they were doing or not doing. And even then, very little has been done in that regard. The fourth plan should have been a plan to also research, to get our own remedies, to treat, to kill the virus, or to protect against it. We should have a systematic research. Of course, such research, biomedical and pharmaceutical research, should be ongoing even without COVID. We have none. The only research activities here are those funded by donors. And the donors fund research that they benefit from. They don't fund research just to save, you know, all these people roaming around our country. They fund research that they have inherent interest in. And I won't bother you with the confusion that is in the research area generally in this country. Institutional confusion in the research area, and certainly no funding. That confusion is mainly in competition for some funding that comes from abroad. But we cannot be a country that survives on the goodwill of others. That we just sit here until Chinese or Americans or French develop vaccine for us or develop a treatment. Countries in the world have spoiled their own environments. The pollution out there, the terrible climatic changes that have happened there are causing the whole world now to look at Africa. There is no way stupid Africans will keep on roaming around here without any capacity to protect themselves. And you think that we shall just stay here. It's not possible. We must develop the competencies to get remedies for things that afflict us. First as Ugandans, but also with the regional and continental cooperation. I've been hearing some, talk that I easily dismiss of some effort they are making to get vaccines or what. But that's not how this thing is done. It must be structured, properly structured. You must have processes that are clear. You must have funding that is clear. Of course, people in Makerere and some place, when they see all this confusion and people just interested in getting some quick, remarks to make, they also, position themselves to get some whatever they can get out of the regime. And I think that's what is happening. I saw a list of 116 research actions that have been launched and that money is going into. The fifth plan that never was is the plan of workplaces that people would go back to after lockdown. Because the reason you lock down is not because people can stay in lockdown. You lock down so that you prepare how you can safely live outside lockdown, how you can continue to social distance after lockdown. And this takes a lot of planning. How markets will be organized and run, how shops will be organized and run, how offices will be organized and run, how schools will be organized and run. It takes planning. The plan as you go, fellows in the NRM junta have realized the utter confusion that lack of planning will result into. Because you saw they declared, for example, that schools will go back, candidate classes will go back on the 4th. Even as they announced that, they had not considered which schools they are going to and how. And it dawned on them that it could not happen. Because some classes had over 100 children. 100, if you have a class of 150 people, now you want to keep a class of 25, maybe. It means you are going to divide them into 6 classes. But these classes, 6 classes, you don't have them. And if you have them, you don't have the teachers to teach the 6 classes because the 150 were being taught by one teacher. So now they say, but then what do we do? You have not thought about the post-COVID sanitary measures. How they will keep their hands washed all the time, their toilets and so on. You have not thought about all this. And when they started thinking about it, then they said, this is not possible now. You stay for a month. What will a month do? We are now going to buy TVs to the village. If they failed to distribute posho in 3 months around Wakiso and Kampala, how will they procure and take TVs to every village in 1 month? Because they said after 1 month they can go back. They should continue learning. How? So you can clearly see the danger in which our country finds itself because of lack of planning. The same with public transport. Causing confusion for our taxi drivers, for borders, for all kinds of things, because there is absolutely no planning. But that is the details of those, again, we have been talking about and we will continue to talk about. But that's the plan that was the 5th plan that was needed. The 6th plan, by far not the least, not the only, but the most critical plan, should have been then the plan for post-lockdown relief and revival. for all Ugandans. Because lockdown battered everybody. Nobody had prepared for it. The greatest majority of Ugandans indeed live hand to mouth. So how are their lives going to come back? How are they going to survive as people? What livelihoods will they have? That plan, to be effective, must have involved all concerned. It must be highly consultative. You must consult the borders. How shall we proceed? You must consult the taxi drivers. You must consult the market vendors. You must consult the Batembei. You must consult all these people in Uganda who make us Uganda. And evolve a plan that covers all of us. Regrettably, as I have said, they have a plan, but it doesn't cover that. And we have seen what their own plan is. Because, you know, we shouted our heads off. Even as lockdown was called, even as these measures were imposed, mitigate the suffering of the people. If people must wash their hands many times with soap, how will they wash when they are worried about the water bills? Many people don't have access to clean water. At least at the basic, provide water. Let people wash their hands without fear that they won't pay for the water. Provide the soap, or make it easy for them to access the soap. At the very minimum, take off the taxes of these. Nothing. Rent. You know, the greatest majority of our people live in rented quarters, which they pay with from their daily hand-to-mouth earnings. So at the end of the month, you know they are going to be evicted. We made noise, make clear interventions on how to secure people. Nothing. Because these are matters that are within the competence of government. National water belongs to us. Power belongs to us. The rivers that make this electricity run on their own, we don't pay them. Just water is ever running, you know. Why can't people have power, have water, have where to sleep? Food. You saw the battle with food. In fact, the little food that people got did not get it clearly because there was a plan to give people food. They only gave food because they thought we would, you know, rally people to either protest, or we would indeed provide food through our own means to our people. It was reactionary. But again, so little, so late, and you know, hunger continues to ravage our people all over. So, the lockdown has gone on, impacted our people very, very badly. There has been talk about 0 people dying of COVID. That's a joke. Well, I don't know whether anybody died infected of COVID. I don't know. It's possible. But you see, I told you COVID first attacks those who are vulnerable. So if somebody has diabetes and is attacked by COVID, his people will say, about them what they were squad. He just died of his diabetes. Even when it is COVID. He is a known heart patient. But even where they are counting COVID deaths, they are deaths of people who mainly had other problems. But even assuming that nobody has died who was infected with COVID, the fact of locking down the country without mechanisms for helping those that need health care meant that so many people died who should not have died. The mothers who needed help to go and deliver, indeed those with other conditions, the heart patients, the kidney patients who are on dialysis, the children who get emergencies at night, who are asthmatic, who are the people who have been dying are many. And we know this because in spite of all the threats, the people's government continued to run the health emergency service, which we had launched before lockdown. Volunteers, our own volunteers, collected about 100 vehicles. We trained drivers on how to drive during a pandemic like this. We provided them with protection equipment and sanitizers and so on. Of course, they were threatened that if they are caught, they will be charged with attempted murder. But we encouraged our people to face the attempted murder and save some of our citizens. And I'd like to take time to thank those young people that have been risking to go and transport desperate people to healthcare centers to get treatment. In fact, even today, the Minister of Health was telling me there is somebody who has been discharged from Kirudu, whom they have to take back to Mukono, where they picked him from. And I think somebody will be going to deliver him back to Mukono. So, this service enabled us to know how many people are suffering and dying without support due to COVID, which imposed the lockdown. No mechanisms in place to secure our people. The people's government, the counseling services, because again we established counseling services, published telephone numbers for people who may have stressful situations, whether related to health or any other situation, part of how do we respond post-COVID. First of all, during the COVID itself, as I pointed out, the plan of the 1% that became clear was that COVID had come as a golden opportunity to loot even in an unprecedented way. That is what clearly unfolded. Because, first of all, if COVID exposed anything, it exposed that our country had nothing. We did not have any reserves in the Bank of Uganda. We did not have any reserve of food in the stores or anything. COVID exposed that we were totally bare as a country. So the first thing that happened in the government was to borrow immediately. They borrowed. The first significant amount they borrowed was 600, equivalent of 600 million euro. That's about 2.5 trillion, which then they started chopping up, sharing. Now, of that 600 or 2.5 trillion, I think it's possible that maybe about 100 billion of the 2,500 billion, maybe about 100 billion will trickle itself, will trickle to the 90%. That's what I estimate. Of the 2,500, maybe 100 billion will trickle. Because it was from that they got the 59 billion to buy food for Kampala and Wakiso. 59 billion. But if you can know 59 billion and the numbers that have actually received food, you know, of course they are saying that they have served more than 1.5 million, which they in fact say they have served 1.8 million, which is a total lie. You live in Kampala, I'm sure all of you are Wakiso. You know, I live here in Wakiso. We have all been suffering with hungry people all over the place who never received anything. You know, the 1.8 million is a total lie. So at some stage there will have to be a serious audit of all these things. You know, the food. And that's why they did not want other people to be involved in the distribution or the processes. They had to go to Kanungu to bring Baryomunsi. You go to Teso to bring Ogwanga. I don't know Ogwanga. I don't know who. People who neither know the places they are acting in or have interest in those people. If it is Lord Mayor Okwago distributing food in Rubaga, he has a vested interest in seeing that everybody gets food. As was taken to State House as classified expenditure. What were those people looking for? They are looking for. It's okay. I wash my hands. Very right. There they are with the tray. So the money that may have trickled, 800 billion went to defense. Again, for reasons not to be disclosed. And of course, the others went to security, to pay all those LDUs who were distributing food and I don't know what. But that was the first indication of the plan of the 1% sorting away the money, either directly or through procurement. Of course, you then started hearing Mr. Museveni talking about masks from Jinja. Soon we saw a supplementary coming to Parliament asking for 1.9 billion for night year. Help it, I don't know, pay which bills. Again, you know, just the collusion of the 1% taking away money under cover of COVID. It has gone on like that. They have since borrowed money from the International Monetary Fund, $491 million from the IMF. And others are lined up. You know, there are billions for people to travel abroad. They are always traveling abroad. They are hardly ever here. Now they were locked here, so there is no money that bought an air ticket. The seminars in the hotels, that is a huge budget. So there is a lot of money in the 2 quarters of the budget from January to July that that is there and that they are sorting away or indeed planning to use in their own projects. That's why even when they announced TVs for every village, I was not surprised. The TVs. Even the food, when they talked about the food, they said milk, we also have milk. Of course, milk is good for our people. But did they get it? But somebody wanted to get part of the money for milk. You know? So, we are now getting out of the lockdown. It's no longer sustainable, first of all, even if they wished it to go on. And there would be all reasons for the lockdown to go on. Because actually when the country was locked down, the virus was quiet. Now the country is being unlocked when the virus is on rampage. And it's rampaging all over the place. But the lockdown is no longer sustainable. We did not do what we could have done to prepare for the end of lockdown. Indeed, all these problems that were caused by the trucks are what we are going to live with for quite some time. So, we must now prepare for the post-lockdown. And having done all those terrible things that I have talked about, you know, looting and all kinds of things, I hear tomorrow they will be telling us what their plan is. I hope that plan could involve releasing our money to us to deal with the terrible things that they have created. And so, we, who are among the 90%, have a duty to protect ourselves, to survive we ourselves, and to prosper. They don't owe it to us. We owe it to ourselves. to fight for our lives, to survive them in fact, and to thrive as a people. So even as we get out of the lockdown, we have been assessing what is there, what is still remaining that they have not yet taken, that we can fight to divide also amongst ourselves to survive. What is it? And other places have been helping us to make an assessment of the money that is there in the